Hello, good morning, good afternoon, good evening, whatever time it is that you're watching this. See, Bentley's over here. Yeah. We just had our first tea of the morning, so he's still napping a little bit with that after the. So what are you drinking this morning or today? Or while you're watching this? I am drinking Stephen Smith silver tip or jasmine silver tip. Stephen Smith jasmine silver tip. I still had a few of those left, so get through those with added organic stevia and organic cocoa honey. Yes. So, how was your week? Anything interesting? Did you just do something for yourself? Hopefully you did. So today we are going to talk about healing through Reiki. I know it may be a little new age for some people, but just hear me out. It's something a little different. It also falls under energy healing along with massage therapy and acupuncture. Interesting enough, those are also considered energy healing. But yes, so Reiki is a form of energy healing. It is an alternative medicine practice centered on the belief that vital life force or universal energy flows through the body, and imbalances in this energy can lead to illness. So practitioners aim to restore this balance and health by channeling energy through their hands or other means. So how does it work in theory? So in theory, like I said, this is going to sound a little new agey to some people, but hear me out. So in theory, your life force energy is the foundational idea, is that a vital life force exists in and around the body. Then you have energy blockage. So negative experiences or other factors create blockages or disruption in this energy flow, potentially leading to discomfort, pain, or disease. And then restoring balance. So energy healing aims to clear these blockages and restore the normal balance of energy flow, activating the body's natural self-healing response. So kind of like in theory is, we're all made up of energy. And in theory that you have like anything negative that happens to you, even if it's something like a trauma, a past trauma, or anything like that happened to you, and you may not have realized that, you put it off, you didn't necessarily work through it, you just put it off, you're like, oh, I'm fine, everything's fine. But in reality, it wasn't, because you have this little thing called a subconscious mind. So in reality, it wasn't fine, and you just kind of pushed it down versus working through it. And so the idea is that it creates like these blockages in your system, or in your energy. So your energy, imagine like this light over you. So kind of like it creates blockages in that. And then that's what in turn causes diseases or healing, because your energy can't flow through. So that's just the whole concept behind it. And Reiki, what it does is it kind of helps work through that. So kind of like a massage working through a knot. So energy is kind of helping maneuver and work around that energy and work that negative part of it out and help your energy flow through appropriate, better, like a blood flow, or like, a difference between like a blood clot, work it out, get rid of it, flow through it. So the blood flow through. Same concept, except for it's with energy and not something like you can physically see or touch. Same concept. So Reiki is a Japanese technique where practitioners channel universal life force energy through hand positions, often held lightly on or above you. Um, so I do recommend, if Reiki is something you do decide to do, if you don't like people touching you, just make sure you let them know. They should ask you that, but make sure you let them know, because even above you, like, it's just their hands, like, at a certain point above you, like, you know, over you like this, so it doesn't touch you. So I wanted to give you a little backstory on specifically what Reiki is before we start talking about the benefits of Reiki. So what are the benefits of Reiki? It reduces anxiety and stress, which obviously, as if you've seen my previous videos, we constantly talk about, like, you have an anxiety and stress, understandably, for this situation, but it built, having anxiety and stress, like, when it builds up. Stress can cause more side effects that you typically wouldn't have. It can also have your immune system working on something else versus what it needs to be working on. So when it reduces that, that's a good thing. It also can alleviate pain and nausea. We always thought about, also in the past videos, anytime it can help alleviate pain, that also leads to less pain medication you have to take, which is always a good thing. It helps improve sleep, which in turn, when, I always said, when your body's able to rest and get appropriate sleep, it's healing itself. When your body's resting, that's what it does. It heals itself. So, definitely anytime you can improve your sleep. And two, if you're having nightmares, like, first of all, who wants to have nightmares? But second of all, who wants to have nightmares about what they are going through personally? So it's, yeah. It also boosts mood and well-being. It supports emotional health, and it increases your energy. So increase in energy, like I always said, that, that's always a good thing, especially in the past videos. I talked about, a lot of times, if you go down the path of radiation and chemotherapy, like, it's gonna zap your energy regardless. And then two, plus cancer, with, what it's doing to your body, causes you to lose energy as well. So you're losing it all around. So anything you can do to help kind of increase your energy is a good thing, because then you're moving, you're doing something, and when you're moving and you're being active, it gives you a little bit of exercise, and that's also helping as well. So even if you're limited on your movement and what you can do, as long as you're getting a little bit of exercise. Remember when I talked about in the book, Radical Hope. Sorry, I had the Radical Hope, the 10th thing that she added in, Dr. Kelly Taylor, for things that people had, like, everybody was doing was exercising. And so even if it's just a little bit of movement, it gives you, even if you have energy to walk upstairs, if you have a 2-story house or stairs in your house, and if it gives you that energy to walk up the stairs and then walk down the stairs, like, that's a good thing. That's a little bit of exercise. You're moving, and you're moving your body, and you're getting it going. Kind of like, they do in the hospital. You don't want your muscles or anything to get stiff, or your bones, because it's going to make it worse when you try to get up and move. So even if you're sitting in a chair or laying in a bed and you're able to, like, move around, it gives you a little bit of energy to do that. That's always a good thing, right? All right. So what happens during a Reiki session, right? A lot of people we don't know, we don't know what it is. It can be scary. I get it. I understand. It's something different. So practitioners places their hands lightly on or above your body. You mentioned that earlier. And the goal is to facilitate the body's natural healing response and encourage the flow of energy. So the session is completely non-invasive and requires no tissue manipulation whatsoever. So unlike a massage or even acupuncture or acupressure, like it's not as, I don't think those are invasive unless you do like a deep tissue massage, but I don't think those are invasive. Granted, so, but some people do, and I mean to some degree it is because it is touching you, but Reiki, like, you don't even have to have them touch you. And interesting enough, like Reiki, like you don't even have to go do it in person. It can actually be something that's done remotely. But granted, I would say it's non-invasive physically. I always feel like if somebody's messing with your energy, regardless, that's invasive. To me, I feel like it's invasive. It's, you still get, obviously with Reiki, you've given somebody permission to do that. Even if I would look at it to somebody like, some people say your mood or your energy, the energy you put off, kind of like the mood that you're in. If somebody messes with if somebody messes with your mood or, that's still invasive. Like somehow it's still invasive. Your personal space, somebody getting too close can be invasive to some people. But in a sense, so Reiki is, I should say, not physically invasive, or maybe what they would consider medically invasive. But yes. So, but you can sit in a chair, you can lie down, you're fully clothed, and they just put either their hand, they either touch you or put your hands on, depending on the Reiki master or the Reiki teacher. There's 3 levels of Reiki. Reiki master is if you teach other people to do Reiki, so you can go up to level 2. 2 then Reiki master is technically level 3. Just a side note, but when you are a Reiki practitioner, I guess instead of Reiki, anyway, they should ask. A lot of them ask. Some of them do better touching versus non-touching, but you can always ask, even if you're calling to make an appointment. If that's something that is going to bother you, you can always ask. Or if it's a game changer for you or a deal breaker for you, you can ask. A session can be between 20 to 60 minutes. Some patients will feel a tingle sensation or warmth, while others may feel nothing at all. Now look, if you don't feel anything at all, it doesn't mean it's not working. All that means, again, getting a little new agey here, some people are a little bit more, or I should say they're open to more sensitive things. So they're a little bit more sensitive to certain things, as they call, where like when they're open to energy, they can feel energy. You have some people that walk into a room and they just feel the energy of that place or that space. Somebody like that would actually be able to feel the tingling on them with the Reiki, like the energy flow. I've actually done Reiki one time. I could feel the tingling because I am sensitive to things like that. It was, and all it is, and all it feels like is, how like you've sat on, like if you sat on your hand or your foot too long and you go to stand up and it kind of falls asleep and it's tingling and you're trying to wake it up. That's what it feels like. That's that's energy flow. That's what it feels like. So don't be alarmed if you do feel it. Don't be alarmed if you don't feel it. It's just what that person's more sensitive to or open to, whether they feel it or not. It doesn't mean it's working either way, like working or not working either way. So yeah. So things to consider. All right. Always, always, always consult your medical team if you're going down that path. When I say if you're going down that path, I know there are people who may do all natural therapies for many different reasons. One, because maybe that's what their gut's telling them. Two, maybe because their doctor has given up on them and basically said there's nothing more they can do other than palliative care. That's their choice. That's their decision. Of course, we support you on whatever decision you make. But if you are taking the path of doing medical, Western medicine as well, as far as chemotherapy, radiation, surgery, again, there is nothing wrong with that. Each person to their own. It depends on what works best for you. Everyone is different. So if you are going down that path, again, always consult your medical team. Let them know this is something you're interested in. And then and see what they have to say. They may even have recommendations for a Reiki practitioner that they use or would prefer you to use because they know that Reiki practitioner understands more, or they're more comfortable with them, or whatever. Okay. Do not replace for treatment. Again, don't just. I'm not telling you Reiki is going to heal your cancer and you don't have to do chemotherapy or radiation. That's not what I'm telling you. I'm telling you this is an alternative thing that you can do that can help some of the side effects that you're receiving from those. Again, some people, like I said, if you decide to do all natural, that's your decision. It's I'm not encouraging it. I'm just supporting you on whatever decision you decide you want to make. Okay. You want to find a qualified practitioner. So there are no universal licensing requirements for Reiki. Right? But there may be reputable practitioners that belong to professional associations. Again, that's something definitely look in to see what their qualifications are to belong to a professional association. I say this because think about, in a sense, if you have your own business, or if you're doing some hobby or some side business or something that doing, and you just pay a fee to say that you belong to this association. Granted, there's some of them that they have to hit certain marks to be a part of the association. Kind of like, and I say in a sense of like, think about it in this manner. If you're a small business, your city chamber of commerce, you pay a fine and you say you're a member of the city chamber of commerce, so you can pop that on your website. Same thing to some degree with the Better Business Bureau. They do have like an association or something that you can pay a fine and boom, you can be a member of the Better Business Bureau association. So it's so it's one of those, like, some of them you can just pay a fee to say you're a member of and be a member of, and not necessarily really mean anything. And then other associations, like, you have to meet certain qualifications. So I would say definitely look into whatever association they belong to, and if that's what qualifications they need to meet for that, to be a part of that. So also too, you can always ask your cancer center or use resources they provide. Cancer centers, like I said, the Reiki is becoming a little more popular. So some cancer centers do provide this. Some cancer centers also have like a resource library that you can go and find things for. And even to, again, definitely check out like your local, like specific cancer charity or organization. So, like anything that's specific for ovarian cancer, lung cancer, pancreatic cancer, whatever you have. Like sometimes the local ones will let you know who to go to. They may have someone in mind you have that they recommend if they don't offer it themselves. And some of the national ones may as well. So, like I said, a lot of times when you start going to, a lot of times if it's local, it's easier to find things because it covers things locally versus nationally kind of covers everything or all over. So it might be a little bit more challenging to find someone locally. But granted, here's the thing with Reiki, because remote sessions are possible with Reiki. So at that point, it doesn't really matter if they're local or not. It just depends on your preference. All right. So again, where to go? Cancer center. You can do remote sessions. Some yoga studios actually provide Reiki or have a Reiki practitioner there. I know that's where I got mine, was with a yoga studio we were working with a few years ago. The SPA, this organization, we were working with them, and they had a Reiki practitioner there, and she wanted to get involved. This is when we were more working on doing a physical location, and she wanted to get involved with us. And I will say my mom's oncologist definitely had recommended Reiki and wanted Reiki as a part of the organization and offering. And so it was at a yoga studio where I found her. So definitely check there. Of course, spas. Some of them have Reiki practitioners. And then, of course, some practitioners have like their own individual space. So it's, like I said, it's definitely something that is becoming more popular and people are becoming more open to. So it's easier to find now than definitely it was back then. And if you want to, you can actually do it yourself. Interesting enough. I don't know if you ever, so sometimes if you take your hands and put them together like this, and then you give it a minute, you can kind of feel the energy going back and forth between your hands. It feels like a pulse. Granted, it's something I'm sensitive to, so it's easy for me to do it right offhand because I can feel it now. But that's kind of the same thing, and so you can kind of do it to yourself. Now there is Aurora Healthcare has a YouTube video of somebody from Advocate Health doing a Reiki session for self-care to yourself, and she shows you how to do it. I did put that video in the link for you, I did put the link to that video in the description for you. There we go. For you to try and do it, for you to, her walk you through to do it for yourself. If you want to do that. Of course, there's also YouTube videos. If you, outside of that, if you wanted to try it yourself. But yeah, definitely it's very interesting. I think, if you want to give it a shot, give it a shot. Leave in the comments how you feel about it, what your thoughts are on it. If you have any questions, I can try to answer it or leave it like or direct you to where you can find your answer, if I can. But definitely something to think about, to try out. You never know. We say, some things it works for some people, others, it doesn't. And maybe it works and you don't realize it till after the fact. So, yes. And yes, I know I owe you guys a video. I was talking about this awesome product. I will try to get around and do that video this week. I kind of got caught up last week. This little one, we ended up having some fun and going to the park for a few days. Yeah. See. But yes, I will try to get that done this week and get that posted for you guys. So until next week, take care, be safe, enjoy your tea, and see you under the willow tree.